All right, welcome everybody. We're back here for another MAT Practitioner Spotlight. And this week we have the honor of having Kika Mela from Florida. And she's been, in the program for years. Again, we got a lot of people that have been around for years. She got her specialist certification in 2008. Then she went on to mastery level in 2013. She got certified at master level. And in 2015, she was one of the first groups. She said number 14 out of the first group in the RX certification. So she's experienced, every level of education, the growth of watching from the outside in, seeing how the program grew. And so it's been a big part of this whole process. So Kika, welcome. Thank you for being here today.
Oh, thanks for having me. I'm so happy to be here and share.
Yeah, I appreciate it. And so first off, Kika, if you want to give a little background, kind of where you were, so before 2008, what you were doing and how you got involved in MAT, kind of what exposed you to MAT in the first place, and then how that kind of affected you in your career.
Okay, so I started out as a massage therapist. So I've been a massage therapist almost 27 years. 1995, I got it after I finished. I was an athlete. I was a professional jockey, and that kind of led me to massage unintentionally. I was supposed to be going pre-med. I had determined I was going to be a doctor, and I wanted to help people. And I knew I had to help people with my hands and somehow. So I thought either osteopathic or chiropractic. And then because of my riding career, and I figured out massage was an option, and it kind of satisfied what I wanted to do, I went into massage school. And so I was doing that about 10 years, and I started working with Pete Bommarito down here in Florida. I interned as a massage therapist in their program. Even though I had 10 years experience, I wanted to learn what they were doing, and they were doing some phenomenal things in massage world related to working with athletes. And I think it was Todd Cholera that came through one day and was telling Pete about muscle activation. And Pete didn't know what it was, and he didn't understand it, but he kept telling me, oh, you should go look this stuff up. It's really kind of, I don't know what it is, but you should look into it. And it took me forever to find you guys on the website. And as soon as I did, this was 2006, I signed up for a Jumpstart course in 2007, January, just as we were getting 40 players in for draft prep training. So we had 40 guys here. It was a big year for us. That I was as well building up way back then. And so at the time in my massage career, I was starting to notice, especially working with the athletes, that deeper wasn't better. I was working way too hard, and I had started to incorporate a form of muscle energy technique, which is really low-grade isometrics to affect changes on the tissue, to either reduce tension or to engage tension. And so I was starting to find a lot of results doing that instead of just hammering on tissue with my elbows and stuff. Yeah. And so Bommarito kind of exposed me to a lot of different things, some Sandy Fritz techniques where it's about muscle patterning and sequence and making a muscle work better. So I was starting to be surrounded by these ideas of engagement instead of submission of a muscle tissue. And I was getting some good results, and I was really intrigued by it. So when I went to the Jumpstart class in Tampa that year, it really hit all the buttons that I didn't even know were there. Like it hit things that I didn't know existed, but I was looking for and I was searching for. And I was like, oh, my mind was blown. This is amazing. But I don't know how it's going to work. Right. So that week we had a young offensive lineman from University of Miami. A week later, within the week after taking the lower body Jumpstart, and Pete brought this kid up, and he was having groin problems. And we have a great facility. We have PT, we have chiro, we have massage, we have everybody under one roof, and we all work together for the athletes. And for whatever reason, this kid's groin wasn't getting better. And I think I must have been the only person in the building at the time, because Pete dragged this poor kid upstairs. He was so hot. He was so mad. I don't know what's going on, but this groin, it needs to be fixed. don't send him back downstairs until it's cured or whatever. And I'm just like, oh my gosh, I don't know. I think that's a little outside of my scope, but I'll do my best. I learned something new. I said, do you want to try it? And the kid was game for it. So we did the Jumpstart lower body. And 10 minutes later, I sent him back down to the turf and he had no pain.
Oh.
And I was just like, holy shit, sorry, this is amazing. And so that was it. I was sold. That right there, I didn't even know what I was doing. And he didn't have a problem with the groin really the rest of the time training with us. I gave some exercises for them to do before he lifted, based on the Jumpstart, things that to kind of jumpstart those tissues before he went to exercise. And it worked out great. So I signed up as soon as I had the money for the specialist course, and that's it. I was all in after that. And it completely changed everything. It was definitely in the path that I was going to, but I didn't know what it was. Mm-hmm. And so it was like a roadmap to where I wanted to be. And before I had not a clue. I just knew there was something out there, something better than what I was doing. And it has opened up, Greg, let me tell you, it has opened up so many doors for me. I've been all over the world. I've done so much. My life has been so amazing. And it's because of the skill set that I've acquired, and the studying and just in this environment that's just been phenomenal. So thank you for that. Anybody to have a fantastic life. I've had a lot of fun.
Well, that's great to hear. And it's neat to hear also for people listening. I mean, you had results with the Jumpstart level. And so it's the foundational principles of MAT that and there's all levels from, we talked about you at the specialist level, the mastery level, the RX level. I mean, you have years of education and training through the MAT process. But your best story right there is, starting just at the foundational principles that you learned in the Jumpstart and being able to help somebody that, like you said, Pete was totally frustrated with because the guy's having a groin injury. And it's neat. It's neat because it's a unique approach. I remember one time I had a kicker for the Denver Broncos came in and he was sent to me with the Broncos. And this is, 25 years ago. He's like, he had pulled a groin and he's like, I can't have anyone else dig into my groin. My groin's so sore. And he came limping in and it's like, well, yeah, you've had enough people dig into your groin. We're not even going to look at the groin. We're going to see what may be putting increased stress on it. And you ended up walking out, being able to go through his kicking motion and everything. And so it's neat because like that, it's just a unique approach that there's a place for. I always say, it's the one improving neuromuscular integrity and function and being able to identify through going through and assessing range of motion to determine where there's potential weaknesses. It's just neat because it provides a lot of checks and balances that instinctively you may have been working with prior to even going through MAT, but having, like you said, a roadmap to steer you in the right direction. Like I think the checks and balances of MAT that we have are what really are great tools for the MAT practitioners to determine, even though they have pain here, maybe the problem's somewhere else, and how to follow that roadmap, like you said.
For sure. It gave me, because like the muscle energy, like I had books, I might have people talk about it, but it was all kind of haphazard to me, like a little bit, well, if it's tight, do this. But that doesn't tell me anything except for it's tight. And if my goal only to release tension, then I succeeded. But there's so much more. MAT really, really helped me step outside of everything and get a bigger picture of the body and not focus on the pain. I'll give you another example that I had that was, so as I was going through the specialist, and I've been doing it a couple of years, it's all layers of education and you get better as the layers get steeper. I've been working as a specialist for maybe a couple of years then, and I had a running back come in, and it was his first time on the table. I was the first person to see him at the facility. So every athlete that comes through, they get eval'd by everybody, PT, chiro, before he trains, because we need to know what he's capable of, what he shouldn't do, what he's able to do. And so for whatever reason, because of the schedule, I was the first person to see this kid. and he had severe shoulder pain. He couldn't externally rotate without severe pain, bilateral, one side more than the other. No, it was it is his left side, and I'm like, I'm not going to mess with your shoulder because I don't know if you have a severe issue there or tear or anything. With the level of pain that you're experiencing, I'm going to wait till you get eval'd by the doctors before I start messing with that. So let's see what we can do. And as a running back, he had bilateral turf toe at some point in his life, and he had zero motion in his toes. So I said, okay, so this is your biggest limitation based on the range of motion exam, biggest limitation without pain. I said, we're going to work on this. So let's just work on the toes and work on the foot a little bit. So we did that. I said, well, no, let's just go back and check your body again to see what else has changed. And he had absolutely zero pain in his shoulder now, like none. And he looked at me and I'm like, yeah, I meant to do that, you know. I was like, oh yeah, that's expected. And the thing is like over the years, that was maybe 2011 or 12, I think it was. And I see it so much now that I just kind of assume that it's not a shoulder. It could be something else. I mean, I shouldn't say assume all the time. I try to look at everything first, but it's not surprising anymore.
Right.
But it's still really cool when you can affect the shoulder by working on a toe or working on a hip or something else, and that shoulder just opens up. So for me, that was, it sets us apart too, because we all work on pieces of the body for the athlete, and they need certain things from rehab. They need certain things from this. And I provide now another level of treatment that they can attain and we complement each other. Our physical therapy complements me. I complement them. Chiro, everybody works together really well down here. To kind of make it better for the athlete.
Yeah, and I think that's a great thing. Like I said earlier, is showing that there's always been a place for it. And being with the Broncos for 25 years now, it's like we've all seen it. There can be turf. Territorial issues with practitioners, and I know at some points in MAT we've had problems with people thinking this is the answer to everything, and when you're in a professional environment like this and you're working with the Broncos, we have the trainers, the physical therapists, Michael Leahy, who developed ART, myself with developed MAT, and the chiropractors, massage therapists, physical therapists, everybody is working together on these athletes, and like you said, it's for one purpose. It's for to improve the function of the athlete, to keep them healthy, and it's recognizing that you have a place and a part of the whole big picture, but it's not just one answer, and I think that's where the people that are the most successful with MAT is they realize that this is what I do, this is what I'm good at, and this is my role, instead of saying, oh, do this, everything else is wrong and this is right. It's like, I see it all the time with the Broncos. It's like there's guys that they veer toward the ART or veer toward MAT or veer toward the chiropractor, and there's a personal issue with athletes too of what they feel comfortable with, and it's like we don't even have the time to put our hands on all 80 guys that are in an organization, and so you get the people that benefit from it and believe in it, and literally even the one where the head trainer for the Broncos would always call it Guru Day, where myself, Michael Leahy, and the massage therapist or not massage therapist, but the chiropractor would all be in it the same day, and say, we'd all work together, and if the opportunity presented itself in the way, we would say, okay, see them first, because they're going to work on increasing your mobility, and then we're going to make sure that you're stable through those ranges that they just opened up. So we all communicated and worked together, and that's the way we should be working in professional organizations. And Pete's done a great job down there of what he's built, and the following that he has, and agents referring, and just everything that you guys have put together. And like you said, everyone that walks in the door is getting evaluated by each one of your professionals. And so you all have to communicate together, from what I'm understanding, would communicate after the evaluations to come up with a plan of how you're going to work with that athlete. And some may involve MAT more and some may involve it less. And that's okay. But it's figuring out where the place is. And I think that's a great, I mean, you guys have done a great job down there of being able to implement a multidisciplinary approach with the athletes.
It's been amazing. He's done a great job. So when we brought MAT to Bommaritos, we started it in 2007, and I kind of took a 2-year hiatus. I quit Pete for 2 years. So I started back. I threw my lollipop down and stomped off. But it was good. It was a good thing. I got to grow in my practice so that when I came back in 2009, he is, we still communicated and I still helped out now and again. But when I came back in 2009 and really started implementing it within his program, and he started to adapt a lot of the thought process that combined with the RTS thought process, really transformed what he did. And we've permeated like all throughout his program. And especially when he took it himself, he took the specialist course himself, which helped our communication just went through the roof. So that helped more than anything. And so it permeated it. So a lot of the things that we do differently, whether, we have educational sessions with our physical therapists, with our chiro. So the more they understand what we do and how we're not trying to do it all, the more trust builds up. So, which is exactly, so when I worked with Jacksonville, I worked with Jacksonville for 3.5 years. I had a wonderful relationship with them. The strength coaches, Coach Milo, the athletic trainers, Rod Scott, and Mike Ryan was the one that was originally there with me. We all would talk afterwards. Like I would meet with them after I was there for the day and we'd talk about things. And they learned from me, I learned from them, and we shared it. It was no egos involved. And I had my due respect for what they were bringing to the table and understanding their responsibility, that if I do a bad job on an athlete, I just don't get to go there on Fridays. If they do a bad job with an athlete or there's a problem, they get fired, and they could have repercussions throughout their career now if they want to get another job. So they have a lot of stress on them. I recently started working with the Inter Miami Major League Soccer team as well. We were brought on as massage therapists, but as we talked and exchanged ideas, there's certain guys that they'll send just for MAT to me. And so we do the massage and we do the MAT. And if I have recommendations, they'll listen. And then they'll say yes for this guy, or not yet, or we'll do that next week. Or it's been a wonderful relationship, but I try to respect where they're coming from.
Yeah, that's great. And it's what keeps you involved too. I mean, if you're not working with them, you're not going to be a part of the program for an extended period of time. And that's one of the things that I found earlier, and actually in conversations over the years with Mike Shanahan, great respect for him, and he's always been great with me. And he's always said, because of how you work with everybody, that's why you're still here, because there's a lot of people that have come and gone because the egos, or they couldn't work with other practitioners. And he said that's what's why you're here, and it's kind of a representation of you and the program. And so that's always been the way that I feel work. The one thing that I think we can all say is there's a place for it. I'm working on one of top players right now, and he's got a whole entourage of people. And the one thing that I can always see is that regardless of what else is being done, you'll always find these neuromuscular issues, the weaknesses and muscle inhibition, and it correlates with tightness and restricted range of motion. And those things may be being focused on, but they're not being, the inhibition issues aren't being corrected through other modalities. And there's where we fit in, is the way that I look at it. There's a place for it, and it's an adjunct to everything else out there. Makes everybody else's work better. We complement each other really well. And there's sometimes when I still do massage. It's still part of what I offer, and there's a time and a place for that.
So sometimes I might have a player come in and we have a great MAT session lined up, blah, blah, blah. But based on my initial questioning and stuff, I'm like, you know what? We just need to chill you out a little bit. We need to, too much is going on, or other things, or he doesn't want to work. They're super tired. You know, they complain about flipping. And I had one player, he would say, Kika, you got 15 flips and that's it, I'm done. And so I might do like 5 and he goes, okay, that's it, just massage now. Just because he was feeling good. But when they don't feel good, whatever it takes, they'll do. They'll do.
Yeah. And that's funny because I'll say this when because it's, I mean, like you said, it takes effort. I mean, the muscle testing and everything. And it's like, I'll say that to people, this isn't like a massage where you just get to lay there and relax because you got to flip over. I'm saying resist. And it's, you're an active participant in this treatment when you're there. And that makes sense. Or sometimes they don't want to do it. I've had times where I can tell when players come in and it's like, I can tell they don't want to be doing the work. And just fix me. Don't make me work.
Right. And they just want to lay there. And I understand sometimes it's a mental thing or psychological or and you can't force it. Or they fall asleep in between. Like they'll fall asleep in between the test and the palpation. And I'm like, and I'm just wake up, okay, wake up. And am I being the most effective? Maybe not. I have another tool I can use to kind of help them as well that might be more appropriate.
Learning to adapt.
So I have to tell you.
Go ahead.
Go ahead. I was going to say, I have to tell you real quick. So when I first went through MAT with massage, I had a complete identity crisis because am I going to shut down tissue? Am I not going to shut down tissue? Like, oh my gosh, I'm hurting people. And it took me a while to kind of get the balance as to when massage is appropriate and when it's not. And what type of massage technique to use. There's so many different types that actually will complement MAT really, really well. And so I had to kind of find that balance between that, trying to figure out how to work together and not work apart from one another.
Yeah. And it's funny because I think a lot of people coming through with trainers, massage therapists, I mean, from every field, they come through and then the first weekend it's overwhelming that, wow, when we put force on somebody's body, maybe we're not doing the right thing. Maybe it's having a negative effect and rather than a positive effect. And like you said, then you have an identity crisis. Like I'm scared to do anything. Right? And then it's figuring out how to take the skills that you have and tie it in with what you learn on the principles of MAT. And the best way to say it, I always say, well, we haven't, I mean, with exercise, massage, anything, we you haven't killed anybody. Right? I mean, such
don't say results. That. People have, there have been, don't say that, knock true. On wood.
Yeah, that's true.
But it changed how I do massage. So we created our own kind of like massage therapy type of program, type of work that we do that complements the MAT, I think really well. And the best part is I have a tool to check.
Yeah.
Did I improve or did I hinder function with my massage? What did I do? And I have a tool now that I can check that I'm really grateful to have.
Yeah. And that goes back to the foundation of how, when I developed this, working as a range of motion functional movement specialist before I even developed MAT, working with the Utah Jazz and having the chiropractor that did applied or clinical kinesiology. And I just got done loosening up John Stockton's hip, and he went back and did manual muscle testing on muscles he had tested that were strong. And now they were weak after I put my hands on John Stockton. And he's like, what did you just do? And it's like, I don't know, but that can't be a good thing. And that was what started I always remember that voice. What did you just do? Like, you made him weak. And I'm like, well, that can't be a good thing. And that's really the day my whole career probably changed, because then I needed the checks and balances of manual muscle testing to determine, like you just said, whether you had a positive or a negative effect, because then you can make decisions. But if you dig into tissues and you have no idea, or you put forces on people's bodies and you have no idea of whether or not it has a positive or a negative effect, it's a risk at all times. And that's not what we want when we're working at the highest level with professional athletes. At all levels. It's actually professional athletes can handle, maybe a little more stress than some of the normal clientele.
Oh yeah. Oh yeah, but that they're such a extreme, like they are so responsive. It's like a regular person in like a small nutshell. Like everything happens really quick with them. They respond really quick. They change really quick. They notice things that
right.
You can make a 50% difference in a regular person, and they're like, I don't know what you did. I kind of feel better, you know. And an athlete, you make a 2-degree difference in their foot, and they're just like astounded.
They're so body conscious, body aware. Yeah.
Yeah.
So kind of time-wise, we're running, pushing time, but that's a great conversation. And I think great having you talking through it and in your experiences, because I think that's a unique part is from what I understand, 100% in the athlete world. And and that's, a specialty, 80%. Yeah. Okay. That's okay. Didn't know for sure. But in the athletic world, and there's a lot of people that come through MAT that don't even really work with athletes. And so it's, there's different directions that people go with it. But I think kind of final words is kind of where you were. You kind of introduced it and what it's done, especially as you evolved through and went through master level and RX. Any words of wisdom for people interested in MAT as a professional, as a practitioner, and or as a potential client?
Okay, so you gotta manage your expectations. What do you expect to get out of it? And understand what you're getting. It's a tremendous and wonderful approach. If you're going to become a practitioner, it's work. It's not easy. And to be good, you have to study. So if you're not the type to want to really get to know something and progress, you'll do okay because it's a powerful tool, but you won't maximize what you can do. And to think along the thought process, like you have to keep studying. You can't just take 1 or 2 courses and think you've got it. And I'll just apply it to the body now. It doesn't work like that. There's more to it than just memorization of tests and things. Especially if you don't do the RX, because that gives you protocols. But as a specialist, you're a problem solver, and you're trying to figure out a puzzle. And if you don't think about not just that joint, you got to think about what's anchoring that joint on the above, what's below it, what else is being affected that can be that you can make a positive effect on. So it's a lot of work and it's very complicated, but it's a lot of fun. So if you like that sort of thing and like working with people and touching people and being aware of their limitations with touch, sometimes we can be aggressive as MAT. Massage has taught me a lot about my body mechanics. It's a physical job. MAT can be a physical, challenging job. And I'm very lazy when it comes to that. I don't like to work too hard. So my massage experience has helped me use my body better so I can work longer, harder hours with less effort on my body. So mechanics is key. And as a person, I found like I don't mind being the last person they see. I've been everywhere and nothing's helped and all that. I'm like, perfect. You're ideal for me. Let's see if as long as you don't have anything broken that I'm gonna damage. I like that because it can help a lot of people, and even as a maintenance thing, just making you function better overall. I think it's a tremendous thing to try.
Okay. That's great. And that's one of the things I've always said. Who's MAT for? Anybody with muscles. and basically it's for everybody. And that's in the final component there, as you said it. When we look back in year 2008 as a specialist, and it's, then master level and RX in 2015. Most people that get through the RX level, they have, 6 to 8 years of education experience through the MAT process. And that's a lot. That's a degree. And so, like you said, it's not something, it's not like a weekend course that you can just take it and think that you're going to be a specialist at it. It's to be good. It takes commitment. And the neat thing is, like you said, everyone's a puzzle. And so, we literally get paid to learn every day. We go to work and everybody brings their puzzle on the table, and you'll see every time you think you have it figured out, somebody lays down and blows away every thought process that you have. But that's also where the checks and balances come in, because it can seem real complicated, but when you take it back into its foundational principles, it's like that can keep the process simple in the most complicated situations. And I think that makes it neat, as opposed to somebody lays down with fibromyalgia, diabetes, kidney transplant, whatever, and then it's like, where do I start? The process can dictate, especially at the RX, where you said it's more protocol oriented. It tells you where to start, and so you don't have to try and figure out that complicated body. You just trust that the process can work. Yeah.
And it helps to, like, I sometimes fall back to isometrics. If any position hurts them. I had a guy with a severe back problem, and I couldn't do anything. I'm like, I don't know if I can work on this guy. Everything hurts. Like, every position is a sharp, searing pain. We did low-grade isometrics. I figured I'm not going to see this guy again. And 6 months to 8 months, like twice a week, he just comes just because now, even if he's feeling good. And he's not eating OxyContin anymore.
Yeah. Yeah, that's great. And I mean, it's great to hear your stories and have you share your stories with us. And thank you for being a part of MAT. You've always been a great supporter and endorser of the product, and you've been a great representation. I mean, it's always been so fun to have you involved, a part of the program. And I always love having you out here when we have our education classes.
I enjoy it too. I'm so grateful because we get to probably introduce MAT to close to at least 80 or more potential football players every year. And that's just in that aspect of things, not to mention the other sports that we deal with. So we like to promote it. We like to refer out to other specialists across the country. We try to find people, and we always have an open door policy and observe or during January, February, or practice. We had a couple of people this year come and practice just to speed up their skill set. We only get 30 minutes with these guys.
It's a whole different environment when you're dealing with the athletes. You don't get a lot of time. So how do you maximize your time and get the biggest bang for your buck when you're working in that environment?
It's you got to be quick. You got to know your stuff and be confident. You can't look at your notes.
Yeah, exactly. Well, Kika, thank you very much for the input and talking with me today. And love that everyone will enjoy hearing your story, and we'll look forward to seeing you soon.
Thank you. I'll see you in September. No, it's going to be sooner. I have to talk to you about the chapter of the book that we're writing.
Oh, really? Okay. Oh, yeah, that's right.
Yeah, I'll call you. Yeah. Okay. I'll contact you for that separate.
Perfect. All right. Thank you.
Thank you. Bye-bye now.
Goodbye.